Welcome. This webinar is brought to you by the New Hampshire Training Institute on Addictive Disorders. You can access the recording of this webinar on our website at www.nahatica.org within our webinar library. After completing this webinar, please complete the quiz if you are interested in receiving a certificate. You can find the quiz on our website next to the Watch Now button you selected to view this webinar on our website. If you are a member of NAHATICA or NADAC, the certificate for this webinar is free. If you aren't a member, the fee is $15. You will receive a certificate worth 1 CE once you have completed and passed the quiz and paid for the webinar if applicable. Through the New Hampshire Training Institute on Addictive Disorders, this 1-hour event is pre-approved by the New Hampshire Board of Licensing for Alcohol and Other Drug Use Professionals, as well as NBCC. ACEP number 6754. If you have any trouble viewing the webinar, audio problems, or have any technical questions, please contact us at 603-225-7060. Please email any questions regarding the material you see today to traininginstitute@nahatica.org. Welcome to Addicted to Fear. I'm Joe Zanella. I'm the clinical director of the ASSIST program for family reentry in Bridgeport, Connecticut, working with duly diagnosed clients, typically that have some sort of legal involvement. Right now, we're going to be talking about what makes us afraid, why we get afraid, but especially why are some people attracted to that feeling and when it can become pathological. Addiction to fear, you're probably wondering, okay, where is that in the DSM-5? Trust me, it's not there. Doesn't mean that it shouldn't be there someday. But what we're looking at are people that have a pathological response. They take being afraid, or what would be a fear-inducing stimulus, and they push it to an extreme limit, to a dangerous limit, one in which they can be hurt, or in fact, sometimes it can even kill them. So fear, let's start right from the beginning. And we're talking about fear and the biological basis. What makes us afraid? And how many things are we born with that we're afraid of? Well, the fact is, we only have one instinctual fear. That is the fear of falling or being dropped, which makes sense from an evolutionary point of view. Our ancestors were in trees. Falling would be the most dangerous and critical thing that could happen if you're in a tree. So yes, we're born with a fear of falling, a fear of being dropped. And you'll see that with children, with infants. Please don't attempt to prove this. You will have an infant cry if they think that they're being dropped or falling. We also have a startle reflex, where if suddenly we're surprised by a loud noise, yes, you will have the child react. But the startle reflex doesn't it means they'll suddenly pay attention to everything going on around them, but they don't immediately cry. So the idea is that it's not a directly fear-inducing thing. Startled, dropped, yes. That's it. We are not born afraid of anything else. And you think, well, wait a minute, Joe, I am afraid of spiders. I was born that way. No, not really. If you look at children and you see a young child with a caterpillar or an ant or a spider crawling across their arm or leg, they'll check it out. They'll go, hey, mom, dad, look. Mom and dad turn around, see a spider walking on their kid, and sometimes they react badly. Oh my God, they scream or they cry or they flick the spider off and they stomp it and are afraid their child's been bit by a spider and they're going to die. The child then learns to be afraid of spiders. All other fears, aside from falling, are learned. Trust me on that. They really are. Well, there's also traits, not instincts, but the traits that we're born with. the kinds of things that make up our personalities eventually. A classic example is that you can take a child and put them in a corner of a room with a pile of Legos, and if you come back in a few hours, some kids are still going to be sitting there playing with the Legos, despite all sorts of other distractions. Other kids, you sit them down, you say, whatever you do, stay right there. Don't get out of that chair. And you turn around, and the next thing you know, they're swinging off the chandelier. Some of us are born with traits to be daredevils. Some of us are born with traits to sit and play with Legos. And, and that's just the way we are. Well, sometimes a combination of the things we learn to be afraid of and the traits that we're born with combine, and in some weird and amazing way, we can get kind of hung up on those to the point where it can look like an addiction. So, if that's the case, and we're using the word addiction, well, can you become addicted to fear? It's pushing it a little bit to say addiction. We use the term addiction a little too freely. We talk about being addicted to chocolate, being addicted to sugar. Well, because of the bell curve, there probably are people that are genuinely addicted to those things. However, it's an extreme minority. There are behaviors that can become problematic, obsessive compulsive, not necessarily an addiction. They can look very, very similar, but they are simply habitual behaviors that can be curbed. We do know that gambling, which involves no chemicals whatsoever, can be highly addictive, uh, very, very dangerous. I've seen gambling take people down faster than crack cocaine. It can be, in certain individuals, it can be startling. People can become addicted to sex. We know that people can have eating disorders, which can look like addiction. They're not clearly addiction. You're really looking at an obsessive compulsive behavior overlaid on genetic predispositions. Very complex causes and effects and treatments, not clearly addictions. So if these things can become addictive, well, what is addiction? Um, I like this definition: a state in which an organism engages in a repeating, compulsive, damaging behavior. I added damaging after somebody pointed out that you really have to have that as a characteristic for addiction. Quite right. It has to be damaging. So on the left are roughly the things that you see as stages of an addiction. And on the right, the kinds of things that people say when it comes to whether it's cocaine or alcohol. And when you get to the late stages, they're maybe beyond denial. They're in some sort of nihilistic, I don't care, self-destructive end at that point, if they're still unwilling to stop. Well, with a few changes, imagine somebody who likes jumping out of airplanes with a parachute. They might do it, they might do it a lot, but there's nothing wrong with that. What if they start cutting corners? They're not checking to make absolutely sure the chute was packed perfectly. They're jumping when the weather's a little sketchy. Maybe it's getting late in the day and they've done a series of jumps and they're tired. Now they're getting into a riskier zone. Now they're taking unacceptable chances, risks, and they're justifying. It can get to the point after somebody's had a series of injuries as a motocross rider or a free climber going up a mountain, and they take injuries and injuries and injuries, and they say, well, it's okay. There's some sort of false machismo around that. Now you're talking about destructive behavior. Now you're talking about something that they can't curb it. They really keep sticking to it. They kind of do fall into the category of what is an addictive behavior. Now, the brain is constantly adaptable. Addiction is based on physical changes in the brain. It's not just that the alcohol or the coke makes you feel good. There are genuine physical changes that happen in the brain. And very often, those changes are permanent. Doesn't mean that they are unmodifiable. You can modify behavior. But some things, once you've learned, for example, you become addicted to alcohol, and you truly have learned that alcohol services something in your brain, you don't unlearn that. 20, 30 years of not drinking doesn't suddenly mean you can drink socially. I'll stand by that. There are some people that believe you can. Those changes will fade over time if you're not activating the neurons. For example, a craving for alcohol will fade. The desire to use will fade. The memory of the good times will fade. But it doesn't mean you can still go back to drinking. So the brain changes, physical changes. These are biological changes. And here we're taking a quick glimpse at the reward system in the brain. So bracket in the middle left says reward. You're talking about a series of structures all linked together deep inside the brain in the limbic system. Those are the things that tell you something felt good. They associate the thing, the amygdala associates it with sights and sounds and smells or people. That's why a song can trigger thought of a person, craving. And then you've got this desire to repeat the behavior again and again and again. And you probably already know this. You should if you're dealing with addiction. You know what addictive processes are. You know where the reward system is in the brain. And then there are these long neural processes that run from long neurons that run from the reward system into the prefrontal cortex and the frontal cortex, where you plan your day. And that's when sometimes the reward system will hijack better judgment, logic, and planning of your mind. It wants to be satisfied. So why is it that somebody can sit in your office, suddenly have a revelation that they're an alcoholic, say, my God, I've never seen it that way before. You're right. I'm an alcoholic. I will now stop drinking. Joe, I've never heard it before. Like, this is it. I'm never going to drink again. I promise. And they, again, it's important to understand how addiction works in the brain. The surface of the brain, this is a slice through the middle of the brain, front to back, showing you pink area. You're looking at the surface of the brain, the cortex. It's only a couple of millimeters thick. That's where the vast majority of gray matter, your neurons, are located. Inside the rest of the brain, you've got white matter. You've got glial cells. You've got blood vessels. You've got neurons that connect different areas of the brain. But the vast majority of processing, of memory, of thought, occurs on the surface of the brain. The reason your brain has all these wrinkles is to increase the surface area of the brain. Your brain likes surface area. That's where the neurons that make decisions are located. It's also where the neurons that store information are located. Sometimes they're the same neuron. It's complicated that way. So that white matter, which makes up about 90% of your brain, it is structure for your brain, holds it in one place, keeps it satisfied with nutrients, it cleans out dead neurons, and supports blood vessels. And that's the way your brain is structured. Well, why is that important? Well, because, and you really want to check out this website, humanconnectomeproject.org. They're mapping the inside of the brain. These are areas that we hadn't previously been able to map before. What you're seeing, and it's complicated, and you don't have to follow all the colors. The colors simply indicate what direction the signal is flowing on that particular neuron, left to right, front to back, top to bottom, whatever. What you're seeing are the nerves that connect the surface of the brain. The surface of the brain is where you store information. You can learn a new fact very, very quickly in a matter of seconds. You can learn a new fact. That fact does not change your behavior. Behavior is different. The lines you're seeing here, these neural pathways that connect one part of the surface of the brain to another part of another area of the surface of the brain, those highways, another way to look at those is that is your personality. Those are your behavior patterns. Those are the things that you built up from childhood. You learned how to walk, and you tried every possible neural connection, and you fell over, and your legs went left and right and forward and back. You finally settled on neurons that worked. Those neurons became thicker, physically thicker. The connections more robust, more synapses joined to other nerves because that was a successful neural pathway. That becomes a fixed behavior. Ultimately, it becomes your personality. It's easy to learn a new fact. You can switch information on the surface of the brain very, very quickly. Somebody gives you a phone number, you memorize it. Boom, you just change some fact on the surface of your brain. Easy to do. You're doing it right now as you take this training. The behaviors that underlie who you are change much more slowly. Addiction is a behavior. It changes very slowly. You can learn cocaine is killing you. Changing the behavior is much different. You can't unlearn that you like cocaine if you're an addict. You can't unlearn that you like alcohol. You can learn when a craving hits to call a sponsor, go to a meeting, pull out the big book, journaling, go to church, to do an alternative behavior. That takes time and training. That's the basics. That's addiction 101. The reason a person can sit in your office and say, my God, I'm an addict. I've never seen it that way before. You know what? I'm never going to drink again. Well, they got the fact. The behavior is going to take weeks and months in order to learn and reinforce and become a new way of doing things. It takes a long time to change those things. This is stuff that was set up in your childhood, it was set up in your adolescence, and in your young adulthood. By the time you're 25 or so, your adult personality is pretty darn fixed. Doesn't mean we don't change. We do. But who you are by age 25, well, that's pretty much who you're going to be for the rest of your life. You can modify it, yes. You can become a better person. But the changes that take place in your teen years and your young adulthood years, those are amazing and radical. It's also why people may fall in love at 18 or 20 or 25, and a few years later be like, my God, why did I marry this person? But that's another training. So the brain develops and changes. And this is everything I just mentioned. We're looking at a 5-year-old brain all the way to a 20-year-old brain. The red area indicates more synaptic junctions. This sounds counterintuitive. As you get older, you have fewer synapses. But the synapses you have are the ones that become permanent and become the go-to. Again, that example of when you're a child and you're trying to walk and you take a few steps, your legs are going in all sorts of different directions because you have too many neural connections. You're trying every possible muscle movement. Eventually, you find the ones that work. Your brain prunes, that's the actual term, it prunes the synapses that don't work as well when you're trying to walk, for example. And they're physically eliminated. They're gone. They're digested back into the brain, reabsorbed. What you're left with as you get to 20-year-old or 25-year-old, you've got fewer synapses, but the synapses you have are now wired into systems that become habitual behaviors. The way you are, who you are, what makes you laugh, whether or not you like science fiction, whether or not you like to be scared, scary stories. Those are things that start early. And this is pretty much what I already said. You can learn new things, absolutely. Changing behaviors, that takes a long time. So don't get angry at your clients when they tell you, oh my God, I'm going to never use again. I swear on my children's eyes, Joe, my God, I now get it. And then they have a relapse. It's not that they're bad people, and it's not because they're lying. It's because that's the way the brain works. It takes time and effort. It's hard to work a sobriety. So sometimes you see people who are doing things that might hurt them. Uh, and yes, I do have tattoo in here. That's become a very common thing now. I'll probably take that off the list. But we as a society are tolerating a much broader range of behaviors. And a classic example that we now see, classic's the word, but what we now see is that somebody can go on YouTube, post videos of them doing very dangerous, possibly self-injurious behaviors, and get hundreds of thousands of likes and hits and reinforcing thumbs up. And we don't tell them stop that. You're going to get killed. Sure, they hear it from a few people, probably their parents, but they're being venerated. You see that with rock stars. The more drunk and destructive they become, the more publicity they get, and the more popularity they gain. So we're in an environment where self-destructive behaviors are being rewarded by society. That is troublesome. And again, none of this falls into a DSM-5 category. So hardwired systems, yes. We have systems that are hardwired and evolved from birth. Your vision, your hearing, the ability to learn things. Those are all hardwired from birth, control the muscles. Those modify and you get better at it as you go older. You also have a hardwired system to be rewarded for successful behavior. You do something, it feels good. Touched, fed, nurtured, all those things feel good. We're born to respond to that. The reason drugs are addictive is that they bypass the hugs, the kisses, the beautiful sunsets, the cheeseburger, all the things that would give off a little bit of dopamine. Feels good. And the drugs mimic those systems in the brain. Deep inside the limbic system, I'm going to go quick on this stuff because you should know it already. You've got the limbic system in the brain, which is basically your brain's BIOS if you're a computer person. You're not supposed to be able to adjust this programming. That's why you can't change your heart rate just by thinking about it or stop your heart. You're not supposed to. If you could, you'd probably stop your heart and not be able to start it and die. So evolution-wise, that makes no sense. Usually the basic functions can't be easily adjusted. Those are things, your digestion, your blood pressure, your levels of insulin in the blood. Those are things that are regulated by the limbic system deep inside the brain. It's also the part of the brain that tells you when things feel good, because inside the limbic system, as part of it, the reward system. And that tells us what feels good. And we're born with certain things that feel good. Food, water, nurturing, hugs, those things feel good. Gives off a little bit of dopamine. That's great. We eventually learn some other things feel good, like a good game of chess, a book, reading Sherlock Holmes. These are very abstract things, or solving a difficult math problem, feeling great about it. Those are things that we learn feel good. And that's because of neuroplasticity and the ability of the brain to keep on learning new things. So we learn certain things feel good. So you have the reward system, as I said, pointed out here. I seem to, when it comes to the reward system, it may sound like I'm being a little repetitive, but you have to understand this is a hardwired system in the body. You're born with it. It can be hijacked. It can be abused, when you use drugs, when you use alcohol, cocaine, gambling. Those things overload the reward system of the brain to such an extent that it hijacks the reward system. It forces it to seek satisfaction. It overloads it. Now, it does that by sending signals to the front of the brain in the form of cravings. The reward system can't speak. It doesn't have words. It gives you feelings. It gives you craving, hunger in your gut. It gives you repetitive, intrusive thoughts. If you're wondering what it feels like to be an addict, if you're not addicted to anything, remember when you fell crazy mad in love with someone, the fluttering in your stomach, the desire to see that you couldn't control, writing poetry in the middle of the night because every person seems to have done that at one point or another, doing wacky things in order to try to satisfy the love of your life who may not care about you. That's addiction. Similar to addiction. Not that love is bad, but mad love, crazy love, obsessive love looks extremely like addiction. And again, you're trying to satisfy the reward system in your brain. So, yeah, that's addiction 101. So does that mean that extreme sports, a little kinky sex, wanting to play with cobras? I actually have a friend who has cobras. I think that's insane, but what can I say? Does that mean that you have a DSM-5 diagnosis, addiction to fear? True or false? Well, the answer quite simply is false. There is no such thing as an addiction. So why are we talking about addiction? Addiction, we know what it can be, and forgive the little extra N here in front of the sentences. Couldn't quite get the program to leave those out. Repeating compulsive behavior is reinforced by the brain, and there's a loss of control. Well, that seems to be what we're getting these people that are addicted to fear. One example is seeing people that are addicted to the rush. They might be addicted to adrenaline, which, sure, there's a little bit of endorphin and dopamine given out just from the adrenaline all by itself, because you will not be adjusting a single neurotransmitter in the brain. You're adjusting systems. When you have a rush of adrenaline from being afraid, you also get a little bit of endorphin and a little bit of dopamine released as well. All the neurotransmitters are part of a system. They are all connected. You don't adjust one without adjusting the others. So we're talking about the traits you're born with, the things that we learn, and what are some of the things that can scare us? What are we talking about in terms of adult behavior? And why? If you've got an adrenaline junkie, it might not be quite as obvious as you think it is. They might not be a mountain climber. They might not be a dirt biker. They might not be driving their jet skis at 500 miles an hour. They might be the kind of person that's always finding drama in others, drama in their life. They are an adrenaline junkie, but it's from manufactured stress. So ponder that as you're sitting with your client. Hopefully it's your client and not somebody in a relationship with, and you're watching that they always seem to want to stir the pot, make problems, see things negatively, create arguments. What are they getting out of that? Well, on a low level, they're getting an adrenaline rush. If they really can't control it and they're getting a huge adrenaline rush from it all the time, they're kind of wired for that. That's become a habitual behavior. They may respond to you explaining it to them, or they may be hostile to you explaining it. But it could be that that kind of personality is somebody that's seeking adrenaline. You also see it with gambling. There's definitely a rush, definitely the excitement every time with the turn of a card or roll of the dice, a spin of the wheel. There's the anticipatory reflex, that adrenaline rush, wondering what's going to happen next. Along with that, you're going to have dopamine, serotonin, all sorts of other transmitters, neurotransmitters, released and adjusted. And there is a theory that there is an imbalance in serotonin in some people, which makes them more likely to become addicted to gambling. There's a little bit of evidence. Are seeing that some people do respond to L-DOPA. Some people do respond to SSRIs. So it could be that gambling is because of an imbalance of neurotransmitters, gambling addictions. So you can treat gambling addiction, and we're finding out that you can use bupropion, Wellbutrin, and it does seem to be effective with some individuals. You're also seeing that the endorphin system is being activated in gambling. Not much we can do about that just yet, but it's possible that we might be able to use some of the medications that are now coming out that block cravings. Ponder that one. So we do find, and here's a study, that some people react differently to the rush, to things that would scare us, to startling images. That's how they tested this. Different areas of the brain are activated in high stress situations. So they seek high sensations, they seek things that scare them. They're actually getting a different jolt from it than the average person. Their brain reacts differently to things that would trigger fear. So quickly, I'm going to go through a bunch of slides. These are the kinds of things that typically would be aversive that we would avoid. We don't like pain. We don't like fire. We're afraid of dangerous animals. We learn, teeth, claws, bad. Driving too fast, I think that gets washed out of us as a child because we're in car seats from a very early age, being driven on highways. So I think seeing speed, seeing us move quickly through the environment is something that we become acclimated to because of that from a very early age. But some people like it even faster. So what happens when people become attracted to things that are normally aversive? Well, like people a mountain climber. Heights are typically aversive. You don't want to fall. Some people are born with almost no fear of heights. Some people, they really don't like it. That can go up to, and this is not necessarily in order of least dangerous to most dangerous, but approximating increasing dangers as you go up. Base jumping would be jumping off of buildings, antennas, structural elements, things that are tied to the earth. So tall buildings, tall antenna towers, that's base jumping when you jump off, typically with a parachute. If you jump off without a parachute, that's suicide. And I mentioned wingsuits. Those are the things that make you look like a flying squirrel. You jump off a building or you jump out of an airplane and you can glide. It's not a true glide. You're actually falling quite fast, but you get some horizontal motion. So it looks like you're flying. In sports, you can get a lot of acclaim being a downhill skier. You can get Olympic medals. Anything that triggers high pain, distance runners, weightlifting, extreme sports, those trigger a lot of pain. That would be naturally aversive. You would immediately not want to go into a boxing ring. Some people do, and they do it again and again and again. Cutting is something that you'll see with some clients. It is difficult to treat. It is highly diagnostic. It falls into multiple categories: borderline personality disorders, parasuicidal behaviors, anxiety relief. You wouldn't think that, but when you focus very intently on the cutting, on the pain that is triggered by it, it can give relief from anxiety. And you're also getting a dopamine release. You're getting endorphin release, which triggers dopamine and serotonin. Hunger, typically, and I'm not saying that eating disorders are addictions. They're far more complex than that. The latest data shows a very strong genetic predisposition, not just a learned behavior. There's a genetic predisposition, and it's researched heavily. But these are things you normally are averse to. You normally want to eat and drink. And I have several clients right now deep in the throes of struggling with anorexia. It is triggering something different in the brain. Their brain is reacting somehow with dopamine and with a pleasurable response to starvation. Speed. Normally, we don't like to be scared when we're driving or motorcycling or whatever. And some people love it. Normally, people avoid fire. I have clients that burn themselves to relieve anxiety. What's up with that? Why would you? Obviously, you want to stay away from dangerous animals. Some people love dangerous animals, like my friend who has cobras and scorpions. I have interesting friends. So, sure. And of course, at the high end of the dangerous end of the spectrum, you have the classical cat lady and cat men as well. Physical danger, you'll see some people attracted to things that are quite dangerous. It's one thing to be a firefighter and be proud of it and excited by the job. It's another to be attracted to it to the point where you crave fire or you crave the action of it. And at the high end of physical danger seekers, you're going to see people that are professional soldiers, that are mercenaries. Now, I have friends that are professional soldiers that are professional. They're not seeking danger. They're superb people. But those that seek violence and seek to inflict violence, well, there's something else going on. And then we have the imagination. Some things scare the hell out of us. Some people, they see a Twilight Zone episode, and that's it. They don't want anything scarier than that. Other people get far into role playing or computer gaming and horror and are wildly attracted to it. So you've got a client, and let's say they are living an extreme lifestyle, and they're arrested multiple times for the things they're engaged in. And they keep doing this stuff. They keep doing things physically dangerous, wild and out there, whatever it is. Maybe they're breaking into parks to ride roller coasters. Do they have a disorder? Can you say they have an addiction to fear? Well, no, it's not a DSM-5 diagnosis. But that pattern and the patterns I've already mentioned before, they are diagnostic. That's the takeaway from this. You're looking at behaviors that are diagnostic of possibly other underlying disorders. This is the takeaway from this training. Sure, on a bell curve, you're going to find some people that are addicted to being afraid. They are there. But it might also be that they have ADHD. Why, Joe? Well, what are you talking about? Well, adrenaline and the serotonin release that comes along with it from being afraid or being in a rush situation, that can alleviate some of the symptoms of ADHD. It causes you to focus on what's going on. That focusing takes away some of the anxiety. It allows the brain to function more accurately. You might be dealing with a person with depression of any source, whether it's major depressive disorder or bipolar. That can be lifted by dopamine. So dopamine, really? Well, yeah, of course it can. And dopamine can be released by other neurotransmitters being stimulated. Adrenaline, endorphins. Endorphins are the body's painkiller. So does that mean things that hurt could somehow relieve depression? Well, indirectly, yes. You might have a person with bipolar mania and they like that neurotransmitter reaction. They like the adrenaline. They're seeking the adrenaline because they like the bipolar mania. And so they do things that trigger more adrenaline, whether they're in a mania or not. They like adrenaline. Instead of adrenaline, they might be seeking drugs that stimulate. So it could be that they're using amphetamines, they could be using coke. Anything that triggers that feeling of being in the rush of the bipolar mania, to feel extremely extremely attractive. So, anxiety disorders? Joe, I don't understand. If somebody's anxious, why would they want to get on a roller coaster? When you're in a situation that triggers fear, something you're afraid of, you often have to become hyper focused. A person with an anxiety disorder, oh, a perfect example, if you're wondering, think of an actor. Many actors in their interviews say that they're socially phobic. They're afraid of crowds. They get stage fright, and then they go on stage. It's like, well, if you get afraid of stages, you're afraid of audiences. Why do you do that? Because when they're on stage, when they're saying their lines, they have to be so focused, they tune out everything else going on. The anxiety can be very focusing. The focus takes away the anxiety. It's a kind of a wonderful double-edged sword. They don't like being afraid, but it allows them to focus on one single thing, probably the thing they're not afraid of, which might be the crowds. And if you've got a thrill seeker in your office, somebody who's engaging in crazy behaviors and getting arrested and doing crazy, wacky things, you really want to be testing. You've got to do your analysis. You've got to find out, are you on drugs? And if you're not, what have you used in the past? And what might you be attracted to in terms of like gambling? Again, no drug involved, but it immediately triggers adrenaline, serotonin, dopamine in the brain. So you want to find out about drug use. All of those things have to be looked at. Just because a person is engaged in something that looks extreme, it doesn't mean they're an addict. It means they are engaged in something extreme. So what system in the brain is linked to addiction? Sympathetic system, the reward system, the corpus callosum, or the fear system in the brain? Ponder that for a moment. And the answer is no, it's the reward system. It's not the sympathetic, it's the corpus callosum. You should know what that is. And there is no fear system in the brain. There's an instinct, but not very narrowly defined as a system. So who are you going to see coming into your office? Typically, they got there because of a legal problem. They often are, if they fall into these categories, they often seem to fall into these diagnoses. You might be seeing an unstable bipolar if they're engaged in all sorts of reckless and possibly speed-related activities. If they have dramatic relationships, repeated violence in the relationship, it doesn't mean they're attracted to it, but it satisfies something. It satisfies something in their personality makeup. It satisfies something physically in the reward system, right? With self-injurious behaviors, you're probably going to see somebody that has, at the very least, traits of a personality disorder. Doesn't mean they may not have a full-blown personality disorder, but they very, 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 very likely have traits. So they'll have some of the characteristics, at least. They also may have a mood disorder. Want to be checking for post-traumatic stress disorder. Repeated near-death experiences. You want to ask yourself, is this person engaged in parasuicidal behavior, or are they really, really trying to kill themselves and they're just not accomplishing? And that can be almost the exact same thing. People that are suicidal, very often we find out that is a very brief moment in their brain, maybe 10, 20 seconds of finally making the decision to kill themselves. And then it's gone. So take all of that quite seriously. You don't want to ignore it or think that, oh, this is parasuicidal or it's just attention seeking. Not. It's quite dangerous. I have clients right now that are engaged in high-risk sexual behaviors, autoasphyxiation, which I have not seen in my practice in 30 years. At least they haven't admitted it to me. And now I've got 2 people that are doing it. And that's one of the reasons that stimulated me to do this presentation. It's very disturbing. It's very dangerous. And it needs directly addressed. So you're looking at mood disorders, underlying trauma, borderline personality disorder, eating disorders, substance abuse issues, anxiety, paraphilia. It's a rather broad range, but there's certain things that you're just able to focus on more exactly. Look at this. So this is how you handle it. You're doing a very thorough biopsychosocial. You have to ask, is there a history of mood disorders in the family? Is there a history of, you don't have to call it bipolar, but ask it and ask it again and ask them again. It almost always runs in families. If they have a mood disorder, there's going to be a familial history somewhere. If you don't see it, that's actually a good sign. Maybe they don't have a mood disorder, but you have to ask. You're doing a urinalysis. You're seeing if they have ADHD, and they may have adult ADHD. You want to be careful when you're talking about trauma. If you do not have training specifically in trauma, you want to probe that very, very gently and on the surface. And for many of these issues, and you can obviously go down the list, for many of these issues, what you're doing is you're consulting with your clinical supervisor or with another professional that does have training in the thing that you're concerned with. If you don't have training in schizophrenia, you work with somebody who has that. If you don't have specific training specifically in gambling disorders, get some training in it, or you work with somebody who has. And that is how you can work with somebody, even if you're not familiar personally or professionally with your disorder. You can still make a very good bonded connection and refer you to the people that can help. So with extreme sports, we're talking about somebody that is a rule breaker, reckless. They don't care about their priorities. That's the danger sign. When it comes to somebody who's engaging in very similar things, for example, mountain climbing, do they spend a ton of money to go and climb Mount Everest and then at the last minute back down because the weather's not proper, not good, not right? Their equipment's not the right equipment? That is somebody that is an expert, a professional. They're cutting edge pioneer, but they don't take reckless chances. It's the recklessness that defines the person that's sitting in your office that has a disorder. Ask yourself, ask them, did you get enough sleep before you did that? Did you get any sleep before you jumped on your motorcycle? How much did you have to drink before you went for that drive? If they are a professional mountain climber, probably not going to see them unless it's a completely other different issue. So that's what you're looking for. You want to know how reckless they are. That's the defining characteristic. How do they manage their participation? They may have a diagnosable disorder. You may see somebody with a personality disorder or substance abuse issue. They may have a gigantic desire to seek thrills in addition to that. So again, it's diagnostic. You get somebody who's a thrill seeker, and they also test as having an addiction to cocaine. The thrill seeking, the danger they engage in, injuries that they've garnered over the years, that's diagnostic. If you then find an underlying disorder, it goes hand in hand and they kind of make sense of it. And again, somebody, and this is how you define it, the recklessness with which they engage in their particular thing. Kind of did this already. We know about the fear stimulating behaviors or behaviors that stimulate fear, or both, can go either way. You're going to get a fight or flight response, which means adrenaline, endorphin, and dopamine. Three different things. The adrenaline is stimulating, focusing, the endorphin, euphoria, the detached feeling, the dopamine is raw pleasure. That's the sex. That's the coke. That's the wow factor. all of those are given off by something that's scary. So if we're really talking about how dangerous these sports are, is it that we're trying to prevent a giant upswell of injuries and death? Well, dangerous, yes. We're not talking about world-shattering figures. And it is hard to gather some of this data. There's no international database on these kinds of injuries and things that cause death. These have been gathered from a variety of different sources, which is why you see them from different years. Among the most dangerous things that people are engaging in, you're looking at wingsuits, the thing that makes you look like a flying squirrel. Those people, they have a very high mortality rate. But still, we're talking about overall not a great many participants. What you're seeing, this is the high end of the curve, the end of the bell curve. The thing that concerns us is the middle of the bell curve. And that's the YouTubers, the people that make videos that hurt themselves, say, hey, mom, look at this, or hey, y'all, watch this. And then they record it, and then they get hurt, and then they end up on a TV show because somebody liked what they saw. Well, what does that mean? It means that you're going to see a lot of this in young adults and adults growing up in this environment. Not necessarily climbing mountains and falling off, but you're seeing a lot of the YouTube-style self-injurious behaviors. Well, there's another thing that goes on. You've got some people that are engaging in autoerotic behaviors or with a partner, asphyxia. That is quite dangerous. It has a relatively high mortality rate given how many people appear to be engaged in it. There's no safe way to do it. There's very poor data on this. I mention it because it seems to be increasing. It's become more known. Some famous people have died of it, and people hear about that, imitate it. And unfortunately, you might see that in your practice. I actually have a client right now that is doing it, and I'm working very closely with trying to save their life. It's disturbing, and you wonder why would anyone do it. Well, the lack of oxygen triggers with them a very erotic response. Again, serotonin, dopamine, endorphins, and it becomes habitual. And with scary movies, well, why are they dangerous? Well, not necessarily dangerous, but it's indicative. We see much more scary things in movies nowadays, much more grotesque imagery on screen. There's two things about scary movies that trigger. There's a sense of foreboding, which is that slow build of anxiety from adrenaline. And then there's the jump scares. They actually trigger two different parts of the brain. And the jump scare triggers the threat evaluation. Oh my God, what I have to do something. Somebody just jumped down. Oh my God. That's different than the foreboding, that constant, gradual fear that's being transmitted. So we can get addicted to that. I mentioned neuroplasticity, so we'll go quick on this. Yes, sure. There are permanent changes that do take place in the brain when we become addicted to something. Does that mean that somebody's always going to be addicted to scary movies? Well, maybe not addicted. I think the fact is they're always going to like it. Can that be reversed? Can a mountain climber not like climbing mountains? Can a dirt biker not like dirt biking? Probably not. But you can teach them alternative behaviors and how to be less reckless with their engagement in their activity. You want to curve them towards something safer. You have a lot of synapses. There's more than all the known galaxies in the known. There's a lot. Those are all galaxies, by the way. You're not seeing stars. Those are all galaxies. Lots of galaxies. You have a lot of synapses. Your brain is infinitely manipulable, changeable. It can adapt. The synapse is where addiction takes place. And you know this, so we're going quick on this one. But that synaptic junction, that point between two nerves, that's where the neurotransmitters flow from one nerve to the other. That's the point at which addiction takes place because that's where the endorphin, the dopamine, the serotonin, adrenaline, that's where you're responding to it. That's where you're craving more. That's where you're building up more or less of your receptor sites. That's where imbalances in neurotransmitters might occur and might mean that some drugs are very attractive to people. Alcohol is a classic example because maybe it's an attempt at self-medication, trying to regulate a lack of GABA, which is a neurotransmitter. So the alcohol does it. So you want to know about the basics of neurobiology, which you should. Quickly, because it's something you probably already know. You have over 100 different kinds of neurotransmitters, well over 100. We haven't been able to clearly identify all of them, but we see nerves talking to each other, and we can't figure out what chemical is doing it, so we know that there's a neurotransmitter we haven't discovered yet. And there's quickly main neurotransmitters that are involved. The dopamine makes you feel good. It also allows you to control voluntary movement. It is also the master power switch that makes you want to get up and do things, not just making you feel good. Every neurotransmitter has many, many, many different functions. This is just one of them. With serotonin, you're regulating a lot of different functions in the brain, sleep, appetite, depression. And it also can make you feel better. That's why serotonin-specific reuptake inhibitors, SSRIs, are popular. They feel good. Sometimes. Adrenaline and noradrenaline, excitatory. The enkephalins and endorphins, painkillers, natural opioids within the brain. You're hearing about all of these because anytime you adjust one neurotransmitter, you're adjusting a bunch of others every single time. Stress causes endorphins to diminish. Low endorphins causes an increase in dopamine. Increasing dopamine usually causes a rush of adrenaline. So it's not just you're adjusting one neurotransmitter. It's a bunch of neurotransmitters. It's a system. Always remember, it's a system. You've got lots of different kinds of endorphins. So when you talk about endorphins, you're talking about more than one. Obviously, endogenous morphine, painkillers, that's the kind of thing that anyone engaged in physically injurious behaviors is getting. They're getting a jolt of endorphin, become addicted. You're seeing in those endorphins and opiates on the bottom left there, the two boxes that show the structure of natural endorphin and morphine. That area that's boxed, even though they're not identical, they're very, very similar, that's the key. That's the key that turns the lock. The two chemicals don't look very much alike except for that boxed area, and that is what turns the key. That is why morphine comes from a plant, acts an awful lot like natural endorphins found within the brain and the body. It imitates a natural substance. Neurotransmitters are important because they do everything. The fact that you're listening to this, that your heart is beating, you're digesting your lunch, breakfast, dinner, you had sleep last night, you're going to do something that makes you laugh later on. All of that is endorphins. That's, neurotransmitters, including endorphins. Everything you do, everything you experience, everything you see is because a neurotransmitter is flowing from one nerve to another. And it's not one nerve to another, billions of nerves to billions of nerves. So manipulating neurotransmitters is the key thing. That's what people are always trying to do. And that's because everything affects us. Everything you see, everything you hear changes how you feel. And when you see something, sometimes you laugh, sometimes you cry, you give things to laugh. The reason and the rationale here is you can change how you feel anytime you want. Voluntarily, simply look at something that makes you laugh. You can see a movie, you can read a joke on the internet, you can do anything that changes how you feel, including watch scary movies, especially if you're addicted to those dark things. So you can adjust your neurotransmitters voluntarily anytime you want. You can also do it through meditation, proper diet, and exercise. Obviously, we live in an electronic era, so the quick way to do it is go on the internet and look at something funny, which I highly recommend. So, why addiction to fear? What's so attractive about being afraid? Think of this. What does this sound like? Fast, heavy breathing, heart rate, pulse pound, etc. Wow, if that were happening to you, which is it? Are you terrified or are you in the throes of passion? The physical body is responds almost exactly the same way to something that terrifies you as something that turns you on. The heart rate, the breathing, the adrenaline, the hyperfocus, the stimulation. Some people love roller coasters. Some people get on a roller coaster and say, I'm never going to speak to you again. How dare you do that to me? Everybody has their own way of responding to things that stimulate us. That might be why, when you see a scary movie, they often throw a little bit of sex into the movie. What's up with that? Hollywood learned a long time ago it's a double whammy. Give the audience both, and you'll come back for more. So if you get the same reaction, that might explain something. The things that scare us, base jumping, roller coasters, paraphilias, maybe it's also stimulating a sexual response. We don't call it that, but it's a feel-good response. What it is. That also might explain something else. Sometimes people in the throes of passion find that they are incapable of orgasm. They're become afraid. They're turned off by stimulation. It could be that they're misinterpreting. The body's in getting the same stimulation. They react differently. They feel the stimulation. They think and interpret it as something terrifying. That is treatable. That is something that through counseling and proper medication could be treated and could be addressed. So it might just be that they're misinterpreting the sexual stimulation as something that's scary. That would explain a lot. So when does it become an addiction? When is being afraid and the adrenaline rush and all that dangerous? When it's harmful to the organism, when it's harmful to the person. So if you like scary movies and kinky sex, you're safe. You're not addicted to fear. It's nothing to do about. But if you take it a little bit too far, well, there's a problem. So assess how dangerous the behavior is. How risky is their engagement? Are they getting hurt physically? Are they hurting others? Are they scaring the hell out of their family? Who is it affecting? How much damage is being done? How dangerous is it? You need to assess that, and you might need to get co-therapy to help assess something that you don't have perfect training in. This is a basic uh, framework for how I treat my clients with addiction issues. They're abstaining. First of all, they have to be abstaining. They don't have to be sober, they have to be abstaining. Sobriety is a lifestyle. They may not be up there yet. They may not be able to do that yet. Get them to abstain. And from there, you teach, you listen. If they need meds, make sure they're taking them exactly as prescribed, and on and on. And teach them how to laugh. Give them things to laugh about, to bring some joy into their lives. Sobriety doesn't have to be miserable. It usually is painful and difficult all by itself. You don't have to make it more so. We have some sources. There are many, many others, but these were quite good and somewhat recent. You can look into these. Good reads. And you definitely want to find out about what's going on with extreme sports and what would be considered extreme sports, the YouTube things that you see on a regular basis. Because that's being imitated a lot by a lot of kids. That's addiction to fear. You've got a bit of a background. Takeaway is that a person in this kind of behavior